Hi, Mr. Phil. This is Zach Leonard in your 8:30 a.m. class, and this is the history of vaccinations. As a child, I was always worried about going to the doctor's office. Walking into the waiting room and seeing the bright fluorescent lights, I would always get a tingle in my spine. I was less concerned with how I was actually doing health-wise, and I was more concerned with if I was going to get a shot that day or not. I would always fear getting that needle into my right arm and could always remember that Crayola Band-Aid the nurse would slap on my arm. While many shots hurt, vaccines are often seen around the world and especially in the United States. To many doctors, researchers, and other scientists, they're seen as the best advancement in the history of medicine. While vaccinations are very complex, their history, current uses, and requirements in the United States are very helpful in order for you to comprehend their purpose. Despite being common today, vaccines boast a long and significant history. According to the historyofvaccines.org, the first type of vaccine was seen in early 200 BCE. However, the first confirmed use of vaccines was seen in the early 1000s. These vaccines were believed to be used by various Chinese groups and other civilizations. However, these groups didn't use a long needle that we're often used to. They'd actually remove the smallpox scabs on their arms and other parts of their body, and they'd blow these scabs into their nostrils. Similarly, in 1706, African tribes used the same technique. They would remove their smallpox scabs and prevent the spread of the disease. Many individuals who used this method became immune to the disease, and others caught on. This type of technique became known as variolation. As others caught on, variolation became common in the United Kingdom, other parts of Europe and Asia, and in the United States. 100 years later, in 1800, Benjamin Waterhouse became the first successful person to administer a vaccine in the United States. He actually did it on his children. Throughout the 18 and 1900s, the UK and US enforced vaccines in order to better prevent the spread of disease. However, new illnesses like the smallpox, rabies, and measles kept popping up and required doctors and other researchers' attention in order to stop the spread of these preventable diseases. These efforts by doctors and other researchers are seen today. There's been a steep drop in cases of polio and smallpox as a result of the vaccines that can be administered all over the world, and especially in the US. While vaccines have a long history, they have a much simplified list of current uses. According to a CDC webpage in 2017, the World Health Organization established the expanded program on immunization in 1974. This program was designed to better protect infants and other children. By administering shots and other immunizations from early weeks after childbirth, children were better protected from tetanus, tuberculosis, measles, and the smallpox. Additionally, according to medlineplus.gov in 2020, there are 4 types of vaccines that are currently available to the American public. Firstly, there's the live virus vaccine, which can protect us from the measles. Second, there are kill vaccines, which can help stop the spread of the whooping cough. Also, there are toxoid vaccines, which can help stop the tetanus disease. And lastly, there are biosynthetic vaccines, which can help stop the spread of hepatitis B. These vaccines are able to stop the spread of diseases and illnesses by strengthening one's immunity. Additionally, they teach your body how to fight disease and do it in the most efficient way. While there are a number of important uses for vaccines, many individuals in the US and all over the world do not feel the need to get vaccinated. However, specifically in the US, there are many state and federal guidelines that concern vaccines. According to ohio.gov in 2018, all kindergarten through 12th grade students were required to get at least 5 shots in order to attend public schools. These immunizations would help stop the spread of disease in large groups, like schools. These immunizations could help prevent tetanus, chickenpox, polio, measles, and hepatitis B. Additionally, according to Justia, the U.S. Supreme Court database, in 2020, Jacobson versus Massachusetts in 1905 was a groundbreaking case for the history of vaccines in the United States. This case called for the allowance of state enforcement for vaccine laws. The Supreme Court expressed that sometimes, in order to protect the public and their well-being and health, that can trump the individual the beliefs and the views of the individual. In order to better understand vaccinations, it is very helpful to review and understand their long history, their current uses today, and their guidelines in the United States. While vaccines have a long history, they're still relevant today. Many of us need to get vaccines in order to attend Denison. Personally, I had to go to the doctor's office 3 separate times in order to get immunized and come to the Hill. Additionally, with the spread of COVID-19, many doctors, researchers, and other scientists are looking for a cure and a way to stop the spread of the deadly disease. So next time you're worried and anxious and nervous about the pain that a shot can cause, remember the good deed that you're doing because you're protecting yourself and the others around you. Thank you.